Mondo, hello world, hola mundo, hello mound, konnichiwa, ni hao, namaste. We're here today in Rome at the Consensus Conference on Nomenclature and Terminology, and Professor Mehta from San Diego would like to comment with me on who may be interested from catching a kind of harmonization of this terminology.
Claudia, first of all, thank you very much for having me here and also for organizing this wonderful collection of people to discuss a very important topic. I think the biggest challenge for us in delivering care to our patients is communication. And I think that commonality of a language and a commonality of us being able to express our needs so that they're understood is the major theme. So in this regard, I think that what we are doing with this Congress is essentially bringing together the thoughts of all the collective people here to discuss elements which would be useful for physicians and caregivers to deliver the care to the patients. The second is for industry and the regulatory agencies to use the same terminology. And third is for the payers who pay for all these services to have a common feature and a language. And then more importantly, as we are going into more electronic health records, is having the same terms used for the electronic health records so they could be looked for data for research and also for further evaluation. And then most importantly, for us to be able to communicate with our patients. And I think that's where we really need to change to make it more patient-centered, give them the opportunity to comment on what we're doing. And then finally, as we write about all our techniques, having a common language. So I think there are multiple facets of this, and whichever way you look at it, it's a very important step.
Yeah, I think that publications, scientific papers, need to have the terminology harmonized to enable us to compare the results of different studies around the world. And electronic medical records also require a common language in order to be able to collect big data, for example, to analyze behaviors, to analyze real life situations. So I think that even if we will not be able to achieve a complete agreement on one term, we can probably define what is the preferred term for an extracorporeal therapy, and then we can list a series of equivalent definitions or abbreviations that somehow can be used. At this point, the electronic medical record can be planned and programmed to say if you use plasma filtration adsorption or continuous plasma filtration adsorption, the terms can be equivalent and so on. I think it's
I agree, and I think one of the other elements which we don't ordinarily think about is the international connotations of this. The language in different countries may speak of the same thing in a different way, but having that opportunity to say that if you call something in your language, it means the same in another language is a huge step forward.
Yeah, if you say stop, stop means stop in every part of the world. So we have to try probably to come to this common ground. Thank you very much, and thank you for following today Cappuccino from Rome, the eternal city.
Thank you.
Excellent.